My name is Abby Bejo, and I am the founder and program director of Lake Health and Wellbeing, which is a public health NGO right here in St. Kitts and Nevis. So Lake Health and Wellbeing, we act as the convener and secretariat of the St. Kitts and Nevis Non-Communicable Disease, or NCD Alliance. With the St. Kitts and Nevis NCD Alliance, we're aiming to bring together NGOs from across St. Kitts and Nevis to work together to advocate for strong NCD policies. The idea is that we want to create a united, strong coalition of NGOs focusing on the prevention and control of non-communicable diseases. This event that we hosted aimed to really build the capacity of NGOs around policies, so that's non-communicable disease policies. And we wanted to give a local, a regional, and a global perspective.
One of the things that I noticed being at the capacity building workshop is people really do want to work together. Maybe sometimes they don't know how policies are created, they don't know how to collaborate, and this workshop empowered people to come together and work with different NGOs, work with the policymakers, work with young people to see how we can get things done.
This is what I need everyone to understand, is that when we're looking at the person, we're looking at the complexities of that person and different identity factors. That when we're doing policy work, this policy work must drive out harmful gender norms and harmful stereotypes that prevent people from living full lives. That we need to understand that we cannot leave anyone behind, and gender is an important issue that we all must focus on.
So we believe it's really important for young people and NGOs to be a part of the policy-making process, because really NGOs are the voice of our community, and specifically in this case, they're the voice of people living with NCDs, and they have real-life experience that they can bring to the policy-making process and therefore strengthen policies, making sure that they're relevant for those persons that are most affected by NCDs.
It was a resounding message throughout the day, is that NGOs have a voice. NGOs have the power to activate change.
Vulnerable groups such as ours, we are left behind. There aren't much conversation about inclusion unless we speak about it. And when it comes to inclusivity, we up front, out front, and forever for that. Because sometimes in most framework and policies, we are not included.
When it comes to setting and understanding this global policy agenda for NCDs, it is important to know that it is oftentimes a state-led process. It is something that's driven by nation states. But as a civil society, we actually play a huge role in making sure that the NCDs agendas and response gets advanced.
When we have policies that have passed and are implemented, we have to continue. We don't just advocate for the policy, but see what is working, what's not working. And still check in with our governments, check in with our elected officials and say, how can this be tweaked? How can we make this better for this place, this community, etc.?
This is never a one-man mission. We're all in this together. We all have responsibilities and duties to play in this, and we can never just say that we want something to be achieved and we just stand on the sidelines and allow for other people to do it. So I think we should all join into this mission, amplify our voices, and make sure that our message reaches even more audiences.
We need all groups and all of society to really work together to ensure that we fight against these non-communicable diseases.
For too long, we've had legislation being passed in silos, so in a closed group, and then it is pushed on the public. And let's say for the health department, okay, why did they consider this aspect of the legislation? So the wider consultative process is always important in designing and crafting legislation.
When it comes to the policy-making process, we would encourage all NGOs to get involved. You have a unique perspective that you can give, a real perspective that you can give, and that can not only strengthen the policy-making process, but ensure that all voices are heard. For young people, we also encourage you to get involved. You're the next generation. All of these policies are mostly going to be affecting you because you'll be the ones that's reaping the benefits or not of the policies that are being put in place. So we encourage young people to get involved in the process. We encourage all communities to get involved. People living with disabilities, older people, younger people, to really get involved in the policy-making process, because at the end of the day, these policies are for you, and these policies are being designed to improve the health and well-being of our nation.